Hi, everybody. This is Agustin Ibanez, Professor of Global Brain Health at the Trinity College Dublin at the GBHI. Today we are going to talking about something that is critically relevant for writing grants. That is the core, the heart of the grant, that is the aim page. So first of all, be sure to choose one idea. So this is very important because the overall idea is that we can work with hand-ons on your specific projects, and during our meeting, hopefully we can work directly with your own idea. So it's important that you don't think about these tips or ideas as in abstract terms, but exactly in one specific idea. And hopefully this idea is the pilot that you want to develop. So this will be a more easy to really develop a more embedded or situated approach to understand this workshop. So the first thing is why we should apply for a grant. So the obvious answer is money, right? But it's not about money, honestly. First of all, it's about impact. When you write a grant, you start to think in the future, you start to think in a team, you start to think in how to solve a huge problem that you cannot do it right now, right? So you want to have impact, and especially in our field, we want to have impact in brain health. And this is really an exercise to imagine the future, to imagine what you want to do. This is a very important aspect of the grant that then, of course, have to evolve into something much more specific. The other critical thing is when you write a grant, in most of the cases, you start to build a team. This will, empower you as a leader, as a mentor for other people. You will bring opportunities for other researchers. And the most important thing, science is a very social initiative. So you will go beyond yourself. You will create a team, like a think tank working together to solve these issues. So the why, you should know when you want to apply for a grant based in these basic ideas. The other thing is when and how. It's I call it. I think that there are four critical aspects to answer that I call it NEPE. So novelty, expertise and competition, preliminary data, and effort reward. So you have to be sure that what you want to do, your specific goal, your specific project, really brings a novelty. Sometimes, novelty means that you are going to develop something that has been done in one field, but you bring in another field or in another context or in another population. Or sometimes you really create a new method, or you want to integrate different approaches in a unique way. But it's very important that you can really estimate how novel is your approach, because this is one of the critical things. There are so many ongoing projects. You want to be sure that your contribution will provide an unique advance, and it could be small, but really should be novel in a specific field or environment. The other thing is you and your team have the expertise for that, and there are other teams that can compete with you. These are very important things. So first of all, if you are going to apply for a grant that is not your area of expertise, you should do it with a co-applicant or a mentor or some person that is really expert in your field. The other thing is think about if you have, exactly the same project that is going to be developed by another group that have more resources or more expertise. Maybe it's not a good idea, or maybe you can contact people who is expert in the field to avoid competition and to maximize the chances to get the grant. Just keep in mind that grants applications are really high demanding, and a very small percentage of the people got the grants. That means that the competition is really huge, and you have to anticipate how well you can bring your expertise, how well suited are you for assessing that. The other thing that is usually most of the grant, not in all, but especially in US grants, is preliminary data. So in US grant, you want to develop preliminary proof of concept based in a subset of data and in a smaller sample and a similar measure that really showing that your hypothesis or your goals can be, accomplished. So preliminary data really acts as a rhetoric aspect to convince the reviewer that you have the tools, you have the expertise, that you can do what you propose to do. For this, it's very important, that you find the best preliminary data associated with your goal. Sometimes you don't need to provide a preliminary result from the full goal, maybe some aspect of the goal or some measure that you are going to use in the goal, but as much close they provide a kind of proof of concept of your specific goals, it will be better. And try to develop always, when possible, preliminary data for your different goals. Usually a grant have one, two, three, maximum 4 or 5 specific aims or goals. So try always when possible to bring preliminary data. Sometimes you cannot have, strong results, but you can have proof of concept, or can you show what you have been done that supports the proposal. You can also provide, feasibility in terms of, backup support, institutional equipment, or other aspect that will, help the reviewer to understand that you will be able to do the project. And the other is the trade-off between effort and reward. My suggestion here is, writing a grant is always a very demanding task. I would say that it's much more demanding than writing a paper at all, because a paper you can get rejection and publish in many other fields, while in grants, the chances to get an acceptance are really, really lower. So you need to think in every single word, in every aspect of the grant. You have to identify as much as possible different caveats and problems, potential reviewer criticisms. This requires, reading and thinking and reading and thinking in a very circular way until you have something very strong. So for that means a lot of effort. So my suggestion is focus on those grants that really can make you, growing, or can help your team to grow, or can make a more transformative aspect. So you have to look at the goal, how hard is the work, how, what you are doing now is supporting what you want to propose, so you have to work less, or, if you have a lot of time to, really propose something that is completely innovative, not related to your field. So this is important. In general, writing grants are very difficult, so you want to maximize the budget. So try to apply for grants that provide more budget. It could be a good strategy, not an universal one at all. Maybe you need, a specific grant that help for specific purposes, of course. But considering the strong effort for any grant in general, you may want to maximize the benefits of that. So the first step before to start writing a grant is that working in the aim page. A grant have many different aspects. Some of these sections are, common across many different calls. Some calls have a specific sections, of course, but one very, very, very important thing is the aim page. It's one single page in which you, provide the overall idea of your grant. Before jumping into the aim page, you have to have one single idea. Don't think about a grant like 10 different ideas. One single idea, powerful, novel, is much more relevant than 10 smaller ideas. So you need to be able, even if you want to measure different things or doing different interventions, you want to bring that in a single umbrella, that is one single idea that any reviewer can understand. This is extremely important because this will allows you to create a storytelling, a narrative, why this is worthwhile, right? So why reviewers will think that, yes, you have to do this project, it's really relevant, I got the overall idea, I know the impact, and you can do it. So don't think that science doesn't use figurative language or poetic structure in the sentence, in the sense of argumentation. You have to create a narrative as a any other poetic piece, science also have a component that makes sense, convince the people that you want to do is relevant. And for that, you need to create an history. This is the most important thing before you start to think. So in your mind, you should have that history. You should be able to, to tell to your mom or your sons or whatever, and they should be able to understand. If you cannot do that, probably your idea needs, more refinement. So first think on that. Then you have to write an outline, a very short outline, basic in the what is expected, what is the structure expected for a grant. We will work on that. We will talk about that, and then you have to be sure and identify the novelty. Be sure that you have the expertise of the collaboration for needed expertise. You have some kind of preliminary data or at the very least feasibility data, and you think that this effort really it's what you need for really grow in your field. So the core of the aim page, it's like a receipt. In the first sentence, the reviewer will know what you should say about a topic. Then the second, then again in the second paragraph. So you have to strictly follow this structure. In this case, you don't have to be creative. You have to follow, the strict structure that allows you in one single page provide first, how relevant is the field that you are doing, then identify the core gaps, not the general gaps, the gaps that you are going to address. Then how you are going to address those gaps, that is the proposal, and a brief description of your approach in which you will present the specific aims, 1, 2, 3, ideally, maximum 4 or 5. Then what are the immediately outcomes? What are the results, the direct result of your grant, and what is the significance or impact of your grant? This is the aim page. If you have an aim page, you have 70% of the grant ready. If you have a robust aim page, then you have a robust grant. If you don't have a robust aim page, then your grant is not going to succeed. This is very important. Imagine that the aim page is just one page, usually 10% of a grant. But most of the experienced reviewers focus especially in the aim page. So if there are errors or this is unclear, you will have a big deal, to convince the reviewers that your grant is really a good proposal. So first of all, let's think in the overall aspect of this. So the first step is you come up with a bullet point, an outline, following the structure of the aim page, right? So then you work section by section. This is the second step. Usually you spend 1 month, maybe 2 months to really improve your aim page, to think what is the best way, if there are other opportunities to improve that. Then you work in specific section by section and do that in the aim page, but also, in the different part of the grant. It's extremely important that you can have colleagues that can review your grant. I suggest you that as fellows, you review each other, your proposals, you work together. So extended minds are much powerful than a single mind. You can use also artificial intelligence tool to review, support and identify gaps, but we will have a discussion about how to use generative AI, in ethical and adequate ways. Then you have to rewrite. Don't think in a grant something that is, an inspiration that comes up in a single moment. This is the idea, or this is the history that you want to do. But then you have to refine and write and rewrite. This is a very circular process in which you start to going back and forth across different aspects of the grant, and you identify gaps, or you identify problems in your writing, right? So problems that you can amend, or you were thinking that this approach is the best, but in fact this another is better. So you need to think in a very dynamic terms. So the grant is not something that is static, it's something that you come up across a process of rewriting and rethinking. And then once that you have the aim page, yes, when you have, fully convinced of aim page, you have thinking in all the potential alternatives, in all the controversies, all the problems that you are facing. Once that you have a very convincing aim page, after that you write the other part of the grants. So now we are going to look at the anatomy of a grant, of a aim page, step by step. And we are going to talk about the colors, the blue or the yellow, whatever. Those colors are intentionally put in there because I will provide you examples and you will identify the different aspects. So the first thing is that your aim page, you have to condensate an incredible large amount of information. So you can start with your aim page that could be 2 or 3 pages, and then you reduce that. But the most important thing, you have to learn to really put all the information in a very short way. This is very important. You don't have to, spend words or being too much verbose for nothing. Each word have to be selected to be in the aim page, and this is not a joke. It's the only way to make any aim page, robust and competitive. So first of all, the writing should be very focused, very specific. You have to think in every verb, in every word, and this is really important. This is what makes a aim page more competitive than an aim page that is going to get low scores, even with the same project, with the same idea. So the way that we write and we use the space in the aim page is critical. So the first paragraph, is first of all, you need to attract the attention of the reader with a hook. Then you provide let's say, I will say, the hook is like, why a topic is interesting. And then you will tell the reviewer what is known about that topic, right? What is wrong, and what is known, it will be always related to what you want to do. But then one of the most critical aspects of a grant is the gap. What are the gaps in the knowledge? Or what are the gaps, in intervention? Or what are the gaps in the policy recommendations? These gaps are not the general gaps of the field. Are the gaps, only the gaps that you are going to address in your aim, in your grant. This is essential. And then you can summarize why this is so important, right? So these 4 components of the first paragraph are essential. So the hook, it's, of course, you can make an introduction of the field, saying, how, let's say in dementia, how huge is the burden of dementia, how it impacts on many lives, the cost, whatever you want, right? But you have to make it attractive. That means if you are going to apply for an Alzheimer's Association grant or a GBHI grant, don't spend too much time talking about general things about dementia, because all the grants will know about that, all the grantees, all the reviewers. So try to focus in the specific field, let's say health economics or multi-component intervention or proteinopathies. So because GBHA is a relatively specific grant aimed to bring health, you try to do a more focused focus of the overall field, but be sure to make it attractive. Think that the reviewers doesn't have time. Probably they don't have any expertise. They have to review many grants, a part of their own business. They don't get paid for that, so they don't have time. So be sure to be clear. Be sure to make the text attractive. Don't increase the effort of the reviewer. So don't use abbreviation, or avoid as much as possible the abbreviation. That is a typical error, because otherwise, you will increase the working memory load of the reviewer. And then in the no information, focus in the aspects that are critically for your hypothesis, for what you are going to propose in the following paragraph. So don't put in the known information nothing that is not critically relevant for the aims that you are going to propose. And then be sure to describe as much as possible the gaps that you are going to address. So the way is, once that you have your aims, specific aims clear, you have to think, what are the gaps that these aims are going to answer? what are the gaps that with this project I will go into bridge? And this is what you have to put in there, but in forms of gaps. So the literature have many important gaps. First, all the aspects related to the first aim. Second, all the gaps that you are going to address in your second aim, but present as a gap, right? And then you say, for all these reasons, that things, let's say an intervention with that features or an analysis with that data, or the study of this population with this method is an essential need to move the field forward. This is the first paragraph. Then, after you have said, the field, what is known, what are the critical gaps, and what is a need to address this gap, you are going to propose how to bridge that gaps. This is your long-term goal. So your long-term goal is a goal that really, integrate the specific aims that you are going to present later. This long-term goal must be presented in a very simple, clear way. Don't be extremely long. Don't be extremely technical. Make the thing easy to understand. So this is your long-term goal is what you propose to do in a way that you integrate all the specific aims that you want to develop. Then, immediately you explain how you are going to do. So, let's say your long-term goal is to develop a multi-component intervention combining, different risk reduction of risk factors in a, underserved population in some country. So then your proposal is how you are going to do it. So I am going to do a randomized control trial where I will select, participants with these characteristics, and they will receive, in one case a multi-component intervention versus in other one standard, let's say, cognitive training or other intervention, and I am going to develop that kind of metrics or that kind of approaches for measuring that. If you are thinking in another project that is not scientific, try to use the same structure. Let's say if you want to develop a program for arts and health. So let's say we are going to introduce different creative experience in the hospital of children who suffer from cancer. And they will, what we are going to do is while they're in the hospital, they will paint they do artistic activities at the hospital, but we will measure, how they feel before and after that. We will measure the level of anxiety, the level of stress, and we will also inform, evaluate the families, whatever. So how you are going to do your long-term goal. Then you have to, this is the proposal and the rationale. Then you have to present your hypothesis. Your hypothesis in this case is the general hypothesis, not the specific aims hypothesis. In this hypothesis, you want to anticipate what is expected. And they even sometimes you don't have clear hypothesis. That is okay, I disagree with some scientists that they think that, you have to have all the hypotheses from the beginning. This neglect the basic aspect of science, that is mystery. Science is about more about mystery than knowing. So, but in any case, it's more easy to understand how you are going to measure that when you have an hypothesis, and especially if you have an alternative hypothesis. So you say, I am thinking that my multi-component intervention will impact, quality of life or cognition or brain signatures or plasma biomarkers, whatever. You will have also an alternative hypothesis, a null hypothesis, that they don't have this impact. This make, one question testable. It provides feasibility and convince the reader that you can really investigate your long-term goal and your hypothesis. So always try to set the hypothesis in the way that you have like what you expect and how you are going to measure if that you expect happen or not. So you have an alternative, a null hypothesis, right? And then you can close the second paragraph, summarizing what will be the benefit. This is more secondary, but sometimes it's important to put in the second paragraph. And then in the third paragraph, you introduce the specific aims. Usually you have only 3 aims. This is the most typical number. Of course, you can have less. You can have 1 or 2, or you can have 4 to 5 or 6. But in general, you may want to develop, the aims that specifically respond to your long-term goal, that are not over-ambitious, but at the same time, that you really address a significant gap. So usually this is why you need to split your long-term goal in different aspects and propose different specific aims. So in the third paragraph, you will have the aim 1, aim 2, and 3. In aim 1, you will see something like, establish the impact of the multi-component interventions in the, let's say, quality of life of patients with dementia versus controls. In the second aim page, you will say, evaluate the additional associations of the intervention with multimodal phenotypes, including, let's say, plasma markers or this or this or this. And in the third aim, you can say, something like, we will establish if there are differences between, gender effects, if female or male respond better or worse to the treatment, if socioeconomic status impacts in that, or any other factor that you want to do. So you disentangle the different aspects of your long-term goal in specific aims. These specific aims have to have an internal structure, have to be able, to develop a clear association. Basically, it's an association between one variable and another. That's simple, a predictor and an outcome. In general, 90% of the aims are these. Even when you can make it complex, you can put a lot of predictor and you can put covariates or mediators and you can put multiple outcomes. Then you can do stratify analysis, or you can do complex things like machine learning or deep learning, whatever. But always, it's something that relates this variable with this variable. It's just that. Of course, you have more associative aspect, more causal aspect, longitudinal designs, etc. So in the experimental strategy, you tell what exactly are you going to do. This includes, how you're going to design your study, what is the structure of what you are going to do, how you're going to measure, and how you are going to analyze. So that should be there. And outcome of impact, it can be presented like as the predictions or the specific hypotheses that you have or the specific results that you are going to do. This is very simple, and be sure to follow always this structure for each aim page. Then, in the final summary paragraph that you have in an aim page, you have 3 main aspects. So you already presented the field, the gaps, the long-term goal, the specific goals. Now you want to do what you're going to bring with this grant. So you can bring innovation, but usually, innovation is less accentuated nowadays in NIH grants, and it's better to just say, what are you going to bring? So the expected outcome in the first case that I proposed is, you will have a large data set with, a method that have an intervention and a control intervention that will have also measurement across different phenotypes. In the second example, in the arts intervention in an hospital for children that go to surgery in cancer, again, you will have a structured component, multi-component, and a structured arts intervention with a specific design, plus a different kind of metrics, pre and post, and different control measures. This is the outcomes. Then the impact is what are, the long-term impact? What do you think that you can really address regarding the previous gap? So in the first thing, you will say, we will, bring evidence showing if multi-component interventions can really delay or mitigate the impact of accelerated aging or dementia. What are the, the most important components that can impact the well-being of the patients? Or in the second, you can say, reducing stress is a core component it's a core aspect of the health during, oncological surgery in hospitals. reducing this impact through arts designs can really mitigate the long-term secondary negative effects of, being an hospital for a surgery or something like that. Just a clarification between outcomes and outputs that is not easy to understand and is not really clear about the how to make the differentiation. No? So you have let's say the outputs are the most concrete aspect directly related. So let's say that you do your project and you get your data, your results, your analysis. These are the outputs. Let's say measurement of this, association of this, a metric of this, a design for that, a policy recommendation toolkit. But the outcome is how these outputs, provide meaning or provides significant advances, but it's still closer to the immediately aspect that your grant brings, while the impact is the long-term impact. It's how this contribute to the field, how this address a critical gap in the literature, how this can really transform the life of the people. So you need to move from outcomes to outcomes to impact, from output to outcomes to impact, and those are your project results. That is the final paragraph. So in one of the references that I provided for this session, you will see that there are clear examples that you can play, and in colors are the kind of contents that you need to have in every paragraph. This is an example that you can also use in an analytical way for a project. The same for the aims section and the same for the final summary paragraph. Let's be sure that when we have our session, you bring your own ideas already and try to talk each other with your fellows to understand what the other projects, how they frame the main page, share your own main page, get your feedback. So you start to think about the inner structure of an main page and how well your proposal is fitting that structure. This is essential. So then, of course, there are many other aspects, but believe me, the end page is the most critical things. In my grants, usually I prepare large grants sometimes, for multiple $1 million for 6 months or 8 months of grant preparation. I spend between 2 to 4 months just in the aim page. Once you have an aim page really, really convincing, you have a grant. Otherwise, you never have a grant without a clear aim page. Of course, there are other aspects, like the research strategy. That is the long part of the grant, and when you make a kind of literature review, you clarify better the gaps. You discuss, how you are going to you detail each specific aim. You bring preliminary data. You explore alternative strategies, expected problems that you can have, and how you are going to handle. All the different aspects that are condensed in different calls. Of course, the bio-sketch is your CV. NIH grants have this very specific way to present CVs in a very short 4 pages, so you have to do a cherry picking of what is more important. European grants sometimes have this kind of narrative CVs where they have another logic. They don't look too much at the scoring. They look much more at the qualitative aspects of your contributions. And of course, there are many other relevant parts like human subjects, etc., etc., etc. One important thing is thinking about the deadlines. We as humans, we always anticipate the forthcoming deadlines in a very bad way. And this is, is a Murphy rule for sure. You never anticipate the timelines, even when you know that you never anticipate the timeline. So be sure that you split the timelines of your work, that you organize that and you accomplish that times, and you do adjustment to be sure that you can get in time. One of the worst things is, sending a grant that is not mature, that didn't have enough time to be prepared. When you have hundreds of grants, the difference between a grant that has been, designed a long time ago, that have been thinker, reviewer, that all the potential problems have been anticipated, all the potential criticisms have been anticipated, that, the coherence between the writing has been really working out. This grant will make a huge difference against a grant that has been preparing 1 week before the deadline. That will be, full of gaps, even when it's exactly the same project. So this is why you need to really planning in advance your grant application. And the other is, be sure that your organization supports your grants. For the pilot, at the very least, you need an organization that can receive the funds. You have to negotiate with them the indirect cost. There is a cap for the pilot grant for indirect costs that the organization has to be sure that they agree. If you are like to apply for international grant, there are many other requirements. Your ERB or ethical committee, it will be in your institution, it will be another. Do you need that? Then, if your institution has the infrastructure support that you need, let's say in terms of, measurements or devices or connections or access to the population, etc., etc., etc. Then try to get, a couple of interactions always with the administrative and financial departments. Different institutions have different regulation. Most of them, they need to know the regulation of a grant in advance to accept the grant, to submit a grant. So be in contact with them. Financial departments sometimes can help you to create the budget, which is, an important thing of the grant, and sometimes you need really, really specific knowledge that financial departments and administrative department can work. And the most important thing, never do a grant in isolation. If you do your own grant for yourself, that means that it's only one mind thinking about the grant. So probably one mind compared to 10 to 100 of minds are much more powerful. So this is really, really, really important that you co-create this. Co-creation means many things. So first of all, let's be sure that you have as much as possible colleagues from up and down. So like people that works for you or people that you learn from. These people can, be part of this application, could create benefit for all, but also will improve the proposal. So this is essential. And be sure also that, let's say, if you work with patients, try to bring the voice of the patient from the beginning. This can be done in a very systematic way, like using public patient involvement, or PPI approaches that are very well characterized, and here in the GBHI you can learn more about that. But also you can do just by observing patients, just by talking to patients, just for asking to the patient. The same if you are doing that in not patient population. Bring the people that you want to study, or bring the phenomena if there is no people that you want to bring to a study, to try to make your application more strong. And then you will get a revision and a result. The first thing is that if you get a rejection, you need to acknowledge how important are rejection. I just want to mention that, my first large grant, it was really a mess. It was a disaster. I got no score in the revision. That means when your grant is really bad, you don't get a score, right? But I got an extremely long criticisms. So many critics that helped me to realize that what I wanted to do, it really needed a more strong approach, a more robust approach. And this helped me to learn more, to surpass the barrier, to think in a better way, to improve my application. So learning by failure is essential. Of course, all of us wants to have the grants, funded. But if not, especially if you are at your early careers, you can learn a lot from failure. And it's essential to move forward, to grow, and to learn to be more robust in your ideas, in your proposal, in the ways that you want to address. And sometimes some grants, you have to incorporate reviewer suggestions, even if your grant is accepted, and this is important. we will talk about revision process and how to deal with reviewers, which is a really complex issue, especially for paper, but sometimes also for grant. And if you succeed, if you got, the acceptance of the grant, the day you got that until you start to work in your grant are the most wonderful periods. You have only just good news, wonderful news. You are extremely, you feel extremely rewarded, but then the problem starts when you have to really deal what you promised to do and how to do it. So be sure that you enjoy those days when you receive an acceptance. So the overall idea is these basic ideas. In general terms, we can really talk about your specific projects in the next meetings, the 2 meetings that we are going to have. So thank you so much, and looking forward to learning more from your projects.